Hello, everybody. This is your time on Aware and Care with Dr. Ambika Nair, who is the co-founder and chief consultant at Santhigram group of companies. Week after week, we are bringing you herbal remedies and the natural remedies to treat your symptoms and diseases and concerns regarding your health. Today is one of our favorite topics we'll all are planning and waiting to discuss. Let's welcome Dr. Nair to the show. Namaskaram, Doctor. Welcome to Aware and Care.
Namaskaram, Madhavi. How are you?
I'm doing very good, but sometimes I do have sleepless nights.
I think you didn't sleep.
I didn't sleep, yes. There's so many reasons for not sleeping, but then sometimes I wonder, is it my age, is it my anxiety, or is it a underlying health condition that is bringing insomnia? So friends, today's topic is insomnia. I'm sure many of you are awake in some part of the planet and watching this program, and together we will understand what this problem is and why it happens. Let's start with understanding what is insomnia and when can we say I have insomnia.
Oh, very nice topic here. Okay, that is that anidra.
Anidra.
Nidra hetu. In Telugu, nidra ledu. Okay. So, like the three pillars of our health are, like good food, balanced diet. Good food in the sense, balanced diet. Whatever you eat, it should digest and assimilate, and it becomes a medicine for you, so that you don't depend upon any medication. Then, what we should do is regular exercise.
Okay.
Physical activities. Okay. And of course, the third one is our sleep. Sleep is more important, actually. Like, see, there are two types of insomnia. Like one is primary. Primary is for a short phase, like you are traveling, you cannot, you are too much of physical activity, some emotions, something happened at, at home or something like that. Any other, like a underlying condition, that is for a short term.
Okay.
So these all, comes under the primary. So you cannot sleep if you are traveling, the weather change, the time zone,
jet lag,
all these things, jet lag, and also it works like that only. Okay. Then, then comes, the secondary means that is these are the triggering factors. Maybe you are on a medication for a long time, you have a chronic ailment, that is also there. Then, like some neurological issues are there. Then, like depression patients, like with fear, like cancer patients, any chronic diseases, with a fear. So that is also there, so these all like, then we can also, yeah, these are the contributing factors for the secondary, like insomnia.
Okay.
So when okay.
Dr. Nair, I believe there are three stages. People talk about, oh, I can't fall asleep. That is the first part. Second part is I can't stay asleep. Maybe I sleep for a very short period. Third is maybe when we wake up, we don't feel freshened up. We don't feel
later they don't. That is all. See, that in Ayurveda, that is actually with the Vata. Vata and Pitta will be, like Vata is very high and your Kapha is very low.
Okay.
So that is the reason, you cannot fall into sleep actually, because that they will be sleeping for like maybe for some hours, few hours, and they will be, like resting only, but they are not sleeping.
So
the mind is running.
So is there a defined time that this many hours a human body needs sleep?
Of course, the natural sleep hours are like, like 8 hours minimum. But it depends upon, like if totally Vata, Pitta and all, like they sleep like 6 hours.
Okay.
But if you get a good sleep of like 6 hours, that is more than sufficient for the body. But Kapha people, they always like, because you can see obesity also, that they become so obese because these people doesn't sleep in time. That is also one of the things.
And that makes you eat and then you fall asleep, and I don't know.
Then, that emotional eaters are Kapha people. If any little strain in the mind, they just eat anything like that. Okay, so that is a little voracious, that is all different. But this is like, okay.
But doctor, you just mentioned that 8 hours, 6 to 8 hours is basically the human body needs that consistent in a period of sleep and rest. But there's so many social factors and socially influencing people who say, oh, you know what, I sleep for only 3 hours. It doesn't matter to me. My body doesn't need it. And then children at young age, teenagers, they tend to follow these celebrities who talk about, my body doesn't need so much of sleep. And then they argue with that. So maybe let's also address that today and understand that sleep is important. What happens during sleep?
That you are giving, because your brain needs, that is called, tarpaka kapha. So that is one of the things, that is another auxiliary dosha of the, the kapha, so which has to nourish the brain cells. So if you are not sleeping in time, means, that a restful sleep, your brain cells will not work properly.
Okay.
Then you can see, that I cannot focus on the work. I cannot remember the things. They are little sluggish. Concentration is very less. So this all comes in that group.
Sleep is necessary.
Because they will be yawning always. So you can see in the class also, because of the, children are attending the virtual classes. You can see that some children, they have disinterest because of the, proper sleep is not there. Laziness is there. Focus issues will be there. You won't be able to remember. Disinterest, actually, it will be there because you don't have an energy. You don't have an energy. That's one of the things. Yeah.
So now you've explained a couple of reasons as to why you may not get sleep, and that's the reason you have insomnia. Now let's also understand sleep disorder by itself is an individual problem apart from health conditions, or is it it is only a subsidiary health condition because of underlying conditions?
No, actually, see, it should not be taken as a very serious issue, but this is manageable and treated very properly. But you have to, you have to identify what's the underlying problem. Okay, whether it is with, like a pranavayu, tarpaka kapha, that's what I told you, whether sadhaka pitta, how the nidra is not coming, how the sleep is not coming. Some people get up, especially you can see in diabetic patients, because it affects the nervous system a lot. So these people will get up, after 3 o'clock and all, afterwards they don't sleep. So it's a big complaint for me. So many times they come and tell that I cannot sleep. And restless, like legs. Some people will have, burning sensation. So it all depends upon the cases also.
Okay, now before we understand more about insomnia and how to treat it, let's also, I'm sure there are a lot of people watching there and saying that my babies are not sleeping, my children are not sleeping, pregnant women are not sleeping, and people who are aging 60 plus, 65 plus, they are unable to sleep and they get up multiple times at night. So I think every phase has a sleep problem, and maybe I'm sure all our viewers want to know more details about it. So friends, today we will take it on a broader subject about insomnia and understand why this happens and how it can be treated. Doctor, do you want to just touch base on all these 4 categories of age groups which have sleep problems?
See, mothers, of course, feeding time, nursing, the children. So these all, but they will find little time in the daytime also to sleep, because that is a phase of life. Okay, of course, because we all went through that phase. So we know that how we manage the stage. So that is normal, actually. Old age means they become vata. Their mind will always be like that only. Like always running around. Oh, I should have. They live in the past. So this is what we see that, because the mind is all, when we see the pulse, we can see that how they will be. So their sleep is not there. Oh, I should have taken care like this. If they, especially when they ail, like financial losses or anything like that, oh, I should have taken care like this. So many separated families and all, they come, like these are all underlying factors. So, like some people will tell that my children doesn't take care of me. Okay, so that all, like you contribute the factors for these things. So their mind is running. Yeah.
You said, the at old age, people are always living in their past. And I think as youngsters, we're trying to live into the future. And somewhere we're losing the sleep over both these past and, future tenses. What is important is the present, where we need to sleep.
See, youngsters will only, it is like a rat race, they don't give any other value for anything else. Okay, once they get, like some diseases or anything only, then they sit and think.
Now,
you
Dr.
know.
Nair, in the current conditions of what's happening around the world with the fear of COVID, the vaccinations, yet fear of mask, lack of oxygen, lack of, proper oxygen because of the mask, and, lack of exercise, going to the gyms or going in outdoor activities, many of us are finding our bodies so constrained and tightened up. And of course, that gives us lots of sleepless nights. We want some remedies and thoughts from you how to treat this problem. And also, if somebody is having a severe insomnia, why they should be coming to Santhigram or approaching a doctor.
See, when they cannot manage it, they should see the doctor actually. Because that is a phase, like you see 1 or 2 days, I told you some transition period or something like that, jet lag or anything like that. Sometimes you get a lot of guests at home. You find it difficult to, because you'll be sitting and talking to them. You don't find time to sleep. Meetings after a few years or something like that. Okay, so like if you cannot fall asleep for like at least 6 hours, then you should definitely find time to seek the help of a doctor.
Okay.
And here, like they will always give so many, like sleeping pills and all.
Yes, I was about to come to that.
Yeah, the sleeping pills, like because see that will help you for time being, but in the long run, I have seen that because your efficiency also comes down with this.
This could be a sense of addiction to those medications also, and sleeping pills could have there. But sleeping pills mostly are prescribed, but I do see people taking some over-the-counter, syrups or something to fall asleep, which is definitely not advised or acceptable according to a doctor's prescription. So, Dr. Nair, a patient is coming to Santhigram with severe sleep disorder. He or she is having problems, not able to sleep, more than 4 times, more than 4 days they're awake, or sleeping only less than 3 to 4 hours. How is the diagnosis taken care of?
Pulse diagnosis is more important actually. And nowadays even virtual consultations are given. So we listen to the history of the patient. Why are they like this? We will find out the root.
Okay.
If they are in, like virtual means, of course I can make out, but still I will ask the history. Otherwise, in front of me means, it's very easy for me. So that I will always see that what their dosha, whether it is related with the nervous system, whether emotional or anything like that. Okay, whether it is kapha related or whether they are going to get whether it is a predisposing factor for any other diseases actually. So that we'll take whether it is depression or anything like that, we rule out. Okay, the diagnosis. Then we prescribe the, like therapies are needed means we will do it. Otherwise, we go with the diet and some exercises what they can do. It's not a must that because they should only do in the gym, like even if you have only one room also, you can walk in the room and do some exercise. That is more important. And usage of oils. Okay, there are very good oils available which will help them to sleep better. So their pitta, like it will nourish also, and they can apply on the head. And body abhyangam is more important, oleation in the body to reduce the vata, and like it will improve the circulation also. This all we give it in the proper way. Then like a panchakarma is needed, we will do them according to their need. We will be doing them.
We will do that. Okay. So, Dr. Nair, many a times our viewers are asking this question very often, especially in a condition like this, insomnia, where there's no physical pain or any discomfort. Yes, like Dr. Nair just mentioned, there are subsidiary things. You may be irritated, you may feel more hungry, you may not be able to concentrate and all that. So what kind of reports do you expect patients to bring along with them when they come to visit you? Do you feel that they can come without any reports and they're fine? And they can start?
I have treated because I had one child, who was not sleeping for 9 years. He had a neurological disorder. Okay, and one of her doctor's son only. When we came to this country, this child came to me. At that time, he was around 11-year-old.
Okay.
No, 13-year-old, sorry. Okay. So, because he was put on so much of medication. So, the father came and, parents both came and, they were first skeptical whether to do for Panchakarma and all. So, we did the Panchakarma. All the therapies were done. Shirodhara was done. Even Thaila Shirodhara was given. After that, 41 days, I think, they had the next, review with the doctor.
Mm-hmm.
So the doctor reduced the child's medication.
Okay.
Okay, so that was a very positive thing, like because they were so happy. He's totally out, like after like 3 months like that, 3 to 6 months, that child was totally out. He was unable even to focus and study. That was there. So we take up such a very, very crucial cases also we take up.
Okay. Mm-hmm. So friends, today's episode, we're talking about insomnia. And of course, that is one of the topics which most of us are going through on an everyday basis. We may claim that we sleep very well, but we all know that there are phases in our life where sleep is not complete. Either it's early school or pregnancy or an impending relationship problem or financial issues, or whatever is a health condition that is giving us sleepless nights. But when it happens more frequently, and once you start observing that you have not slept for more than 3 to 4 days, proper 6 to 8 hours, it is a time for you to go and talk to a doctor, whether at Santhigram or anywhere else. Dr. Nair always insists that it's not always about Santhigram, but it is a forum here on Aware and Care where we give you information so you make the right decision to take care of your body and your families. Now, Dr. Nair, when you just mentioned a 13-year-old child came to you for treatment, so that itself is such a comfortable factor for us to understand that this treatment, Ayurvedic kind of treatment, is applicable for all age groups. There is no restriction.
Of course, actually, we get a lot of patients, so we take care of them.
Okay.
They all are satisfied, actually. Yeah.
Okay. So I know we're going back to the roots, and Ayurveda is all about going back to the roots and reliving and understanding what is good for our body.
And so many spiritual people come, because actually people are very much interested in spirituality now. Okay. So it is a pitta dosha found in the heart, like a sadhaka pitta. So it contains, emotions will be there, spirituality will be there, the indecisiveness and your desire, what to do, what not to do. So it's so it creates imbalance with the pitta and the vayu. Everything will be like imbalance. So that's a very crucial stage. We get a lot of clientele like that, actually. They don't know what to do, helplessness. So they will tell that, so it leads to anxiety. Oh, I get palpitation when I go to bed, when I lie down. I can hear how the heart beats to my, I can hear in my ear. When I get up. So what they will do, they will get up, they start walking very fast in the rooms. So very interesting cases comes to us actually every day.
As
some people doesn't sleep because they think that when they sleep, they will get a heart attack. So fear. So fear also, because actually there are so many factors, it's a very, very interesting subject also, but very difficult to convince the people also, so then, once you do step by step and with the counseling and the diet and everything, then they understand. They will reach the goal. They will gain the goal, I should say.
Yeah. Absolutely. And programs like this always help us to reach out to each other, friends. Many times because of social media and people are on the phones, we always notice some of our friends being awake at 2 o'clock or 3 o'clock at night. In different part of the world, we see hey, what are you doing awake? You're not able to sleep. Whatever could be the reason for that. So Dr. Nair, before we get into more details of it, now let us also go through a step-by-step process of understanding how to sleep. Like I just said, that we are going back to our roots and recorrecting ourselves, or, rebrushing our thoughts about how to sleep is also very important. We just can't jump into bed and close our eyes.
Try to at least, if you are unable to see, some people will go like 1 o'clock, 2 o'clock and all.
Yes.
Then, because it all, shift duties are there, so they can find their own way of sleeping, because actually I'm talking about the other people. So if you cannot fall in place, means you can apply some oil, like even sesame oil also you can apply on your foot, on the sole of the foot. It will help a lot actually. And you can have...
Dr. Nair, let's do one thing. Now, traditionally, according to Ayurvedic science, what is the time span before you fall asleep that you should start following your directions towards? 2 hours, 1 hour? What should you be doing? Let's go like that so that it helps.
That if you are not sleeping, you can do a abhyanga.
Okay.
When you oil and you take a hot water bath.
Okay.
If you can apply oil on your head, that will really make you to sleep very fast.
Okay.
Because Madhavi, so many children will come to me. These children, they are very playful. They become very active at night. They don't like to sleep. So we tell the parents, what they should do is that they should give a bath give the oil to them so that they will give oil bath in the night, after which they sleep, and they are very fresh in the morning, especially for the school-going children.
Children, okay. So, so that is basically the oil. What about what kind of food should be avoided or eaten before sleep?
Very heavy, like meat and all, which will digest only should be taken. But, the grapes can be taken if you are unable to, like a bowl of grapes. Because draksha is very good for that. It will induce sleep.
Okay.
Glass of milk with a nutmeg.
Okay.
Warm milk, not cold milk. Warm milk is very good for you. So that will also. But if you have a lot of kapha, mucus and all, don't take. I don't advise you. If you are taking, then you put turmeric in that also.
Okay.
Yeah, this all will help a lot.
So, what kind of vegetable and fruits calm the brain or mind before sleeping?
That's what I told. Nutmeg is good actually.
Nutmeg is the
very good actually. See, cooked food is the best actually.
And Dr. Nair, many people after dinner like to go for a long walk. They feel that is a very calming effect. And then they feel very tired after walking and then they don't sleep. So walking before sleeping is recommended?
After eating, they should have, because in Delhi, and because I practice in Delhi, I know that after, but they will be going and eating ice creams only, especially in summer. So I cannot say that because they are walking. They will be talking and going. Okay. So before, I recommend actually before your food, you should walk.
Before your food, you should walk.
Okay. Then, you get enough time also for everything. Otherwise, because see why? Because after eating, suddenly we don't like them to sleep. So mild walk is okay. Then they are not awake. They will sleep off. Because they eat very well. Actually, half the tummy only they should eat in some dinner. Yeah.
That's an interesting point that you mentioned, because that's what we are doing today. We've changed so many things about our lifestyle. We want to go for a long drive after, having a good meal, and then we feel that we've not been able to sleep. Now I find the reasons as to why this is. Any important factor that you want to mention about insomnia that you want our viewers to know and to take care of it as we wind up the program?
Say, listening to the music is okay. Very nice it is. But seeing movies, on the what you call on the phone, that is not good actually, because you are not sleeping nor you are listening to the movies. But some people will get interest, a lot, so they will, unnecessarily wasting of time. Keep off your devices when you sleep, and try to sleep. That you can just pray whatever your prayers, whom all you believe, you can just pray. Say whatever you did in the day, that is like a journal. Okay, so you can thank the God and try to, get a good sleep.
Yes. Gone are the days where we used to write a diary or, count the sheep or the stars before sleeping. Today we are looking at the television, and I don't know, I think across the globe, it's a common story that when you read a book, you fall asleep. But when you're watching TV, you're not sleeping. So there is a factor. But most importantly, apart from all the fun that we had also talking to Dr. Nair today, the most important part here about this program today is to know that if you are having a sleep disorder, it must be addressed immediately. It cannot be taken for granted, because there are lots of subsidiary problems that will come, whether it's health issues, thyroid, diabetes, or lack of concentration, because people are driving.
Hyperthyroidism is also, that's what I told you, because you have to diagnose the case. Hyperthyroid also, they don't sleep actually. There are so many diseases, because we already talked about all those things.
Yes, absolutely.
That's what I'm not mentioning it.
Yeah.
But you can find out, if a person sleeps, you can find out from their face how fresh they look.
That is true. That is so true. So the problem here is, or rather the solution also is, that if you have a health condition that leads to insomnia, it can be treated. But if you have insomnia, it can also lead to a lot of health conditions and problems later on. That also can be treated. So for both, you need to have a consultation and have a talk and understand the problem. Thank you so much, Dr. Nair, for today's episode. I definitely will have a sound sleep today.
Okay, go and sleep. Okay, you can do an abhyanga, take a warm water bath, then pray and sleep.
Thank you so much. Thank you.
Thank you so much.